the past 45 years, actually, the sequence of the World Symposia represented some very relevant cornerstone for the development of the knowledge, the scientific knowledge of pulmonary hypertension, meaning not only treatment but also diagnosis, definition, classifications. And this has been recognized by all the experts in the field. Every one of us wait for the new Congress, new World Congress, for acquiring the state of the art of this science, because we consider pulmonary hypertension like a medical science. The science of pulmonary hypertension is very peculiar because it includes the relationships between heart and lung, and pulmonary circulation is one of the two circulation of the body, and has specific characteristics, and is more difficult to explore the pulmonary circulation as compared to the systemic circulation. This is why the pulmonary circulation and pulmonary hypertension science requires a specific approach. Why we decided to found an association around the sequence of the world meetings? Because we think that the periodical World Congress every 5 years probably is not sufficient to cover all aspects of pulmonary vascular science. This is why we think that a sequence of events between the major congresses that usually are organized every 5 years, we believe that we need to fill the interval between the different events with additional educational and scientific events. The impact of the World Association will be a sort of focus of all experts on different topics and different new aspects. We want to maintain the activity in order to be ready for the subsequent world meeting, and also to help the interaction between all experts in this field. So the colleagues who have organized this organization, this society, this association, we can utilize different names, but probably the best description is a group of friends, because we are friends. And we started since the beginning to work in this area. And the first world meeting was held in Geneva in 1973. We were quite young at that time, so but the second, 25 years later, we were already there. We found immediately a sort of brothership, and every time we were able to organize the next meeting, the next meeting, the next meeting. I started with my graduation thesis in 1979 because it was on pulmonary hypertension. At that time the area was not so relevant for clinical medicine, and I get passionate with this. And I think that my major contribution is the demonstration that initial combination therapy is much better for the patients as compared to monotherapy. Pulmonary hypertension patients require excellent centers, and the organization of an excellent centers improve a lot the treatment of patients. The treatment of pulmonary hypertension is not just a prescription of drugs. It's a strategy which requires a multidisciplinary team and organized follow-up. Our initiative, including the website, will help the interaction between the different stakeholders of this area. And of course, we will organize meetings, but also we would like to help the interaction through the web. We have included a task force of patients in our ward meeting. This is very important. It's for the first time the patients had a task force. The importance, the relevance of interaction with individual patients and patient association, because all together can improve the progress. The interaction between doctor and patients is very, very relevant, and of course the interaction of this association with the patient association will be very, very strict. Another major point that we need to develop is the interaction of junior doctors, because junior doctors are those who make the most relevant work in the field, either clinical field or basic science. It's very, very important to remain concentrated to the different aspects of this field and be persistent over time. Our association may help to maintain the focus on this specific medical area.